None of us could have known that COVID was going to come, but as a mom, we have to multitask, but this is multitasking times 2.
I was getting all kinds of calls from people in our community. If I could do errands for them, go to the grocery store, pick up their prescriptions.
I'm able to provide care to my children and my husband and my mother. I feel like I have to stay structured, otherwise it would be straight chaos.
Homeschooling him and then working at the same time feels like I'm Wonder Woman or something.
The hardest part about the day is trying to find time to fix lunch, to help with a math problem.
It's like my maximum speed, and I'm doing like 100 miles per hour nonstop.
I haven't had anybody I can rely on. Everybody relies on me. And I do my best to handle everything.
Papa one, now I get Papa one.
I feel my body deteriorating.
Caregiving is definitely underappreciated, especially now with COVID-19.
COVID is the unknown. I've never, ever, ever been scared to do my job.
A lot of people think that caregiver is the last thing that you want to do. I hold that title with pride. It's very scary and daunting, but I've been able to find those beautiful moments.
We're all together and we're healthy and I know we're safe.
Yay, got a new pet.
We're a close-knit community. We take care of each other. We know what it's like because we're doing it.
And my hope is that we can create a society that cares for us as caregivers the way we care for others.
Hello and welcome. Thank you so much for joining us today for the Leading with Care Town Hall. My name is Aijen Poo and I'm the Director of Caring Across Generations, a national campaign to support caregivers and win policy change that allows our families to thrive across the lifespan. And I just want to start by honoring all of you caregivers out there. Your work is such essential work. It is essential to our health, our well-being, and while you may feel isolated and powerless at times, we're here to tell you, you are not alone. There are millions of us, and we are powerful. Together, we're going to change the way we care for our families in America. There is a light at the end of this tunnel, and now is our time. Those of us in this town hall know that long before the public health crisis we face today, there was a simmering care crisis in this country. We struggled to find and afford good childcare. We risked losing our jobs if we took time off from work to care for our loved ones because so many of us didn't have paid leave. And we struggled to find or afford care in the home and community for ourselves and our loved ones. And our caregiving workforce, who do the difficult work of supporting our families, couldn't support their own families because of low wages that kept them in poverty. This was our reality before the pandemic, and now the entire country is feeling the pain. We have kids who are home from school and daycare, having to learn through screens, including our children with learning disabilities. We have essential workers like home care workers who are the lifeline to our family members who are quarantined in their homes, working without health care or hazard pay. And their own kids are home too. We've been separated from our loved ones in nursing homes and trying to figure out how we care for each other from hundreds of miles away. These pain points are the result of choices that policymakers made and chose not to make to secure our families and the workers we count on. And we won't stand for it any longer. We cannot stand for it. We cannot sustain this. And now that the election has been decided, it's time for action. It's our time for a new set of choices to be made for this country and our policymakers to prioritize caregivers once and for all. Imagine an America where when you're preparing to have your first child, and you can be confident, regardless of where you work or what you do, that you can take time away from your job to spend with your newborn without worrying about whether the job will be there when you return. And when you do return to work, you're able to afford the kind of care for your child that nurtures their unique potential from the start. And if you're born with or develop a disability, you have access to the services needed to live a fully dignified whole life, connected to your family and community. And as you age and maybe need more assistance, you're able to rely upon the support of family and professional care workers who are supported in caring for themselves and their own families too. Imagine that. This is what a strong care infrastructure for American families would enable. This is a vision that is more possible now than ever before, especially now that we have a president-elect who is committed to making caregiving a priority for economic recovery. But it won't happen on its own. It will take all of us and everyone we know coming together and taking action to make it happen. It's up to us to make sure that any plan for COVID relief and economic recovery includes big investments in our care infrastructure, our ability to afford childcare, take paid time off, have access to home care services for the aging and for people with disabilities, and to support our family caregivers, to offer good jobs for the care workforce. All of this is the first step on the road to economic recovery. It includes all of these priorities. We're tired of the false choices between services and wages for our care workforce. We're tired of being told it's too costly, it's impossible. We're tired of being treated as if it's a personal responsibility or failure when we can't figure it out, because we know it's impossible to manage alone. If we can build roads, bridges, and transportation systems to bring all kinds of goods to our doorsteps, we can build the infrastructure to support our fundamental need for care. Today's program is all about how we make that happen. And we're going to hear from some of our new champions in Congress who are leading the charge toward our vision for care. And we're going to hear from leading advocates and caregivers who are driving the work forward to make this a reality. And we're going to make some clear and simple commitments to action to ensure that care is at the very top of the agenda. And we want to hear from you. Be sure to tell us in the comments where you're calling from and let us know what questions you have for our speakers and what ideas you have for how we make this vision a reality. To kick off our program, I'm very, very excited because we have my friend and lifelong leader and champion, Congresswoman-elect Nikema Williams. Nikema has been an organizer and a champion for justice, for healthcare and equity her entire life. Before becoming elected to the United States Congress, she worked for Planned Parenthood and for Care in Action. She served as a state senator, and she is also a mother to Carter, a family caregiver, and every bit of her life experience has made her moral compass infallible. A Southerner through and through, and a friend and mentee of the late, great John Lewis, Nikema was put on this earth to help us realize our dream for democracy and for an economy that leaves no one behind. We're so fortunate to have her leadership in Congress, and I cannot wait to see the good trouble she will make for caregivers. Nikema Williams, thank you so much, Congresswoman, for joining us today.
Thank you so much, Ajen. Thank you for having me. And you know that I am happy to have this conversation at any time because this is a part of who I am and my lived experience. Y'all, I am Nikema Williams, Congresswoman-elect from Georgia 5, and I am here in Washington, D.C. in new member orientation. And I think it was perfectly fitting today that today is the day that I've been lost many times up here on the Hill over the course of new member orientation, but I walked past the House Democratic Caucus room And today on the agenda was the floor schedule, was Child Care is Essential Act, was written on the bulletin board. I don't know if you can see it in my phone, but I took a picture, a selfie, because it said Child Care is Essential. And I had no idea that I was going to see that today before I walked past that billboard, that blackboard today. But that is just, I mean, that is telling of where we are in this country, where we've always been, but now everyone else is catching up with what we've known for so long. It's not just childcare, though. It is care from elder care to childcare and everything in between. And I know this very personally. I know what it's like to have saved up all of my vacation time over the course of years so that I had time to take off with the birth, after the birth of my son, Carter. And I also know what it's like to have a mom who was suffering from terminal cancer, and I needed to be there with her and had given the time to take off from my job, but I just didn't have the time to take off. And so I ended up leaving the workforce to make sure that I was there to care for my mother because she needed me at that time. And there weren't provisions in place that were supported through our care infrastructure in this country. I also know what it's like to be on the other end of this because just last year, my Uncle Bill, who had open heart surgery and has no children of his own, he needed someone to be there for him. But at that point, I was in a position and in a job, and as the deputy executive director with Care in Action, and I was able to take the time with my Uncle Bill to make sure that he had the supports that he needed to get back on his feet. And then now with the pandemic, y'all, I cannot tell you how much I appreciate Miss Betty, who sits with my Carter every day to make sure that he's able, as a 5-year-old who had to attend school in front of a computer screen, his first interaction with kindergarten is in front of a screen. But Miss Betty is there with my husband and I every day to make sure that Carter is getting the support that he needs. So you will not find anyone better than me in Congress who is willing to make sure that I step up and lead on care issues. But it won't stop with just child care. I know that universal family care is where we need to lead in this country. And with the new administration, you have my commitment that I am with you every step of the way, because these are my lived experiences, just like they are yours. And I cannot wait to be sworn in January and continue to lead with you, because I can't do this alone. And I'm willing to stand with you in this fight to get this right for our entire country and get universal family care passed. Thank you, Ajen, for giving me this opportunity to speak. And I'm looking forward to getting this done with y'all because, like you said, priority for the economic recovery has to include care. And now is our time. Let's get it done, y'all.
Beautiful. Let's get it done. Thank you so much, Congresswoman-elect, for joining us amidst this crazy time of orientation and learning a new city. And we are so excited to have your leadership. And now we are going to dive in and have a few conversations between key leaders in the movement to talk about the care policy change we need. We'll start by hearing from Nicole Jorwick of the ARC, which is the largest national community-based organization advocating for and with people with intellectual and developmental disabilities. Nicole will be in conversation with Dr. Michelle Hernandez, a Latinx disabled clinical psychologist with over 20 years of experience in the diverse global field of humanistic psychology. She was diagnosed with an autoimmune disease called juvenile rheumatoid arthritis and decided to help others with disabilities. Over to you, Nicole.
Thank you so much. I'm really glad to be joining you all today to talk about our experiences. My name is Nicole. I'm with the ARC, and I'm also a family caregiver. My brother, Chris, has autism, and so I know this experience from both a professional and personal level. I'm so excited to be here to talk about the LTSS component of the infrastructure of care strategy. As we know, in order to build back better after COVID-19, we've seen laid bare the fissures in the systems that we rely on as caregivers. And frankly, due to the decades really of underinvestment in the areas that all of the groups represented here have been working on, we've been working hard to collaborate and wrap all these issues together. The issues of modernizing Medicaid to expand access to home and community-based services, childcare, paid leave for all, and supporting the workforce. But first, I want to explain what LTSS or long-term services and supports are. It's a broad term that encapsulates both nursing home or other congregate or institutional services, and also includes home and community-based services. When it comes to these services, the main game in town as far as the payer is the Medicaid program. Medicare does not cover these services, this LTSS, whether it's inside a congregate setting or in the community outside of short-term rehabilitation. So it is Medicaid, and that is really the main payer, unless you're one of the select few who were lucky enough to get private long-term care insurance, or families like mine and like many of ours are left to private pay for those desperately needed services to keep people safe and healthy and happy and living meaningful lives in their homes and communities. LTSS broadly are important, but where we must focus is on the expansion of access and infrastructure for the delivery of those home and community-based services. Right now, there are almost 1 million people on waiting lists, and that's just people who know there are waiting lists to be on. And we must build the infrastructure to serve those individuals and to get people who are stuck in congregate settings out. As we have seen, the racial disparities in the infection and death rates in communities of color, especially in long-term care facilities, one way to solve that problem, the main way to solve that problem, is to get all people out of those settings. In order to do that, we have to have the support for those home and community-based services. That's enough for me on background, and very glad to have Dr. Hernandez with us. Ijen already did her introduction, but we're very lucky to have you here to talk about your own personal experiences with LTSS. And so glad to have you. And I was wondering if you could describe the process that you've gone through, Dr. Hernandez, in order to access home and community-based services.
A little bit about the process is that I think I want to say a couple of things. Oftentimes there is no outreach for these extra services, so people don't know that there is even such a thing as home-based community services. And once, like somebody else was referring to, the waiting list is extremely long. So like Nicole said, people get on the waiting list because they hear of a waiting list, yet they don't exactly know what services they're applying for. And then once they email you or contact you, there is another process. That's just the beginning. And that intake process goes from a caseworker to a case supervisor to a social worker. And not only do you have to fill out paperwork, you have to meet with your doctors have to fill out paperwork. Caregivers have to fill out paperwork. You have to have a backup caregiver, a backup plan for the community. And this all can be overwhelming to somebody that has no idea these services exist, but are in essential need to have these services because of their disability. They need it to survive. So it's quite a conundrum. Right. And my experience, even though I started, I want to say in May or June, and because of COVID, the waiting list went from 18 months down, to half that. So I was actually lucky to get somebody to even contact me. And I just got approved, I guess, last month, but I still don't even have the services because of the paperwork. And so how do you figure out how to pay your caregivers when you don't have the money, but you can only tell somebody you're going to have the money for them because they're depending on their job to live and support their families, but you don't have the money out of pocket. And that's pretty long story, but it really captures the essence of how this can be frustrating, time consuming. It's hard to keep track of who's in charge of what. And like Nicole said, people, that have intellectual and developmental disabilities, I'm a PhD, so they don't give those away. And I have a hard time keeping up with these services. And my goal in life, being a clinical psychologist, is helping other disabled people and seniors in crisis. So how can I serve my clients best if I can't even get out of bed in the morning because I can't pay a caregiver? And it's beyond frustrating, and it's really unhealthy, and it's scary, and people are dying, and that's our reality, unfortunately.
And I know from my other friends with disabilities too, that the real fear is that without access to those services, the only option out there is a nursing home or a congregate setting, which is the last place anybody wants to be right now, but also you don't need to be there. And it's much less expensive to serve folks in the community, but we have this disparity in what's paid for in the Medicaid program. And so and I completely relate, Dr. Hernandez, because I'm obviously in the disability field. I am a family member, and I can't tell you how many times I wanted to pull my hair out when I'm talking to one of my brother's case managers, or when he went through the healthcare system after a fall last year. I was like on one ear talking about healthcare changes that we need to make in the federal government, and not being able to navigate it for my own brother, which is a whole different kind of demoralizing. So I completely relate.
Exactly.
I was wondering if you could explain a little bit what it would look like and what it would really mean to people with disabilities and to aging adults to have easier access to these services without all of this process that you just explained.
I imagine, I've been thinking about that a lot. I imagine that it would be nice if there was some component to ease seniors and individuals with disabilities, to ease their anxiety around this. I mean, being a mental health professional, it's ironic to me that this whole process takes so much time, energy, that of course your anxiety is going to increase. Of course you're going to become overwhelmed. Then you feel more isolated because of COVID. And that's not going to help get your needs met in a healthy way. So I would hope that there would be some psychological component, and obviously I'm biased because I'm a psychologist, yet there needs to be something that normalizes this in a much more positive arena. Mm-hmm. Another aspect that people don't realize is when you're applying for all these services, nurses and doctors are going to have to ask you questions that are very humiliating, that you don't, like, can you go to the bath? Like, I'm just going to be blunt. It's like, can you go to the bathroom by yourself? Do you need somebody to wipe you? Can you get out of bed? How many times do you go to the bathroom in the middle of the night? So you basically go through an hour of answering all these questions to prove that you're disabled, so that you can get services. But let me tell you something, after that hour, you feel like shit about yourself. Yeah. And nobody's even acknowledging that. Nobody's acknowledging that. The public just thinks, oh, well, you're eligible for services, just go get them. It's not that fun. No. They put you through hell to get a couple of hours of paid work that you're not going to get a caregiver right now during COVID to even sign up for, because their life's at risk just as much as ours is. Yeah. So what do you do?
Yeah, and I know when I know we're going to have to wrap up, but a couple points that you made when we were talking earlier that I wanted to make sure that we made is a really good point that you made, which is that disability is a group that anyone can enter at any moment. And so the point that you're talking about all of these issues is really important, because it's an issue that can and does impact so many people. And it's also something that could impact anybody at any moment. And I also know we talked a lot about the need to educate not only individuals with disabilities and aging adults, but also the general public, right? Because I know you mentioned that you didn't even know about home and community-based services until you needed them. right?
Yeah. I mean, I didn't know anything about home and community-based services until 2 years ago. I woke up in the cardiac ICU and I didn't even know I had a heart issue. So I maxed out all my hours for in-home support services, which, isn't a lie actually, but, and somebody said, well, you can apply for this. And I didn't even know about that. And so, to go from not just being able-bodied to disabled, I mean, I had a disability before, but, oftentimes there are co-occurring disabilities. One might lead to another. A lot of chronic diseases are unpredictable and painful. And so I feel like to be very inclusive, we need to just realize that disability doesn't just look like that handicap placard that everybody sees in the parking lot.
Yeah, it involves a lot. It involves a lot more than that. Thank you so much, Dr. Hernandez, for sharing your experiences with me and for talking about this really important issue. And I look forward to working with you and everyone on making sure that not only the disability community, but the broader public understands why we need to work on this issue. Now it's my pleasure to introduce Fatima Goss-Graves, and Lynn Redmond Williams to talk about why it is so important that we work together to weave these issues together, the stress of the sandwich generation of caregivers, and about many things that we're all lucky to hear about.
Thanks so much, Nicole. I'm Fatima Goss-Graves. I am president of the National Women's Law Center based in Washington, D.C., and I am so glad to be with all of you for this important conversation. I also am a caregiver to young kids who I am hoping don't race in right in the middle of this town hall, because this is around the time where they come back inside. And I'm really thrilled to be in conversation with Lynn. This pandemic has revealed so much about what was already fragile in this country. And one of the things that we know it revealed was what was happening with women in jobs that were dominated by women. And so women have been overrepresented as essential workers. That's more true for Black and brown women who are working in fields like healthcare and as caregivers. But they also have been overrepresented in the fields that lost jobs. And at the same time, they are overrepresented as paid and unpaid caregivers, just as our care needs have been turned up. And as these forces have come together, what we have seen is this she session, as my friend Nicole Mason calls it, has put extreme stress on women in this country, and on Black and brown women in particular, who are stressed by the economic crisis before them, stressed by the care crisis, and stressed by the public health crisis in this country. In September alone, we saw over 1 million people leave the workforce and stop looking for work. Over 800,000 of them were women. More Latinas left the workforce in September than all men together. So there is also a quiet thing that is happening in this country. And all of that brings me to the conversation that I'm lucky enough to have with you, Lynn. Thank you so much for being here. And I'm hoping that you could just start by telling us a little bit how COVID has affected your life and in particular, your life as a sandwich generation caregiver that so many of us are.
Well, first I want to say thank you, Fatima, for having me on here. It's always a joy to talk about, to talk with Caring Across Generations and all the things that they're trying to do right now. For me, I'm a mother, I'm a wife, I am a caregiver to my mother. I also have 3 children, but my youngest is 11. I am a minister. I am a friend who has several friends right now that are in this sandwich generation of caregiving. And I am the unit director of a Boys and Girls Club, which I am at right now. Herein lies the purple doors behind me. And so I'm also hoping that those children don't get too loud at this moment or bust through my door. I've kind of put up a barrier there so it doesn't happen, but we never know.
Don't deal with it.
This is definitely trying times right now, even in my job and in all the adjustments we've had to make. Just last week, we switched from being after school program to becoming an e-learning hub in order that we may be able to serve more families and be the hub where parents can still work. Mom can still go to work and drop her kid off here, and we're able to help those children during the day with e-learning, which is just a whole new subject.
Can we talk about that a little bit? Because the virtual learning piece that's happening in this country and the stressors that it's putting on families, but also children. 1 in 3 Black women right now actually aren't working in the home. They're working on the front lines as essential workers, but their children may be in virtual learning programs.
Right. My daughter is at home virtual learning while I'm at work. But here, because of COVID, we're serving up to 40 children a day. And so we have them spaced throughout the building with no more than 8 to 10 kids in a room, and the whole virtual learning. Anything can go wrong. And when I say anything, I mean anything from Zoom not working, breakdown in the internet, not knowing the schedules of all the children that we're serving, this child saying, I'm done, and nothing has been turned in. And so it's so many things and it's stressful for them. I will say, even for my own daughter, I have literally watched her grades drop. She's always been an AB student, and I'm not even seeing those results. And as a mom, I'm concerned, but then at the same time, I'm throwing my hands up and saying, just do the best you can, because right now, nothing is normal.
Yeah. I mean, and that nothing is normal is right. But what is still the case is that families have to pay for things, right? That they
Absolutely
have to pay for rent and food and support our families. And I know for probably the families that you're serving, but all of us are feeling it so deeply. Each of those things are not going away, even as the pandemic has upended our lives.
They are not. And I will say, in terms of costs, thank God that here at the Boys and Girls Club, we have only charged $25, and that's just one flat fee. But for my own child, I couldn't afford to put her in daycare. My husband lost his job this year also. And so with us having that, but he's looking for a job and he finds things to do in the meantime. But at the same time, with my daughter being at home and she needs help. She needs help with e-learning and things like that. Whereas here, that was the number one complaint last week that I had from parents. They wanted to know how much it was going to cost them for their child to come here. And I had parents literally weeping when we said it was only $25 because they could not afford the daycares that they were going to have to put their children into.
Right now, our policymakers in Congress are having lots of quiet conversations about what to do. And I know they have been hearing from people in this country that care infrastructure, which was already so fragile, is not doing it. And in the midst of a racial justice reckoning, too, I guess my last question for you is, if you have a chance to talk to some of these policymakers, what do you think they should know? What do they need to know families are facing?
One of the things that we're facing, of course, is, like we said, the crisis with childcare, being able to just afford it. Another thing that we're facing is when we have someone like me that's a sandwich caregiver, I have to find balance. I have to choose, am I going to work today, or do I really need to go and help my mom today? What am I going to do? Am I going to choose to take the day off, which I have a little paid leave left, but if something was to tragically go wrong, would I really be able to take that time to help my mom? And the answer is, if I had to choose between that and work, I want to choose mom, but I also have my own household to take care of. And the one thing that I think I want policymakers to know is that this isn't, I don't want people to look at this as something as people looking for a handout. What people need is a hand up. And with that hand, there needs to come help. There needs to be things that positively come into our lives that help us not only generationally, across the generations, caring across the generation. So it's helping me in the middle so that I can help my mom up here and so that I can help my child down here. And literally, the last time I spoke about this, the image that I keep getting is the village. It takes a village. And so across that village is generations. And generationally, we are looking for that help so that there is something for my child. There is something for my children's children. And so I think that these policies need to come into effect in some type of form or fashion where it is helping the daycares, it is helping the providers, it is allowing people to be employed in those areas to help. It's not just about helping that person. We would be opening up doors for employment. And then we also have the care, the balance, like I was saying. Can I take this day off to go and take care of my mom? Is there a paid leave act that can come along and say, hey, this lady needs to take care of her mother, which also opens up doors. And if I can't, can I afford to pay someone to do that? Is it in my mother's insurance plan for that to happen? And most times it is not. And that's unfortunate. So I do think that policy needs to change.
Well, Lynn, I just appreciate you so much. And I think you're giving voice to what so many of us are feeling right now. You have basically described the infrastructure that is necessary for our families to function, for our economy to function, for all of us to function in this time. So thank you so much.
Thank you so much.
And I am going to kick it over to my friend and lifelong activist, Wendy Chen from Family Values at Work.
Hi, everybody. It's nice to be together today. Lynn, before I forget, I'm going to answer your question. There is a paid leave act. We're going to get it done together. But you know, the thing that I have been thinking about listening to everybody so far has been just a feeling of actually hope, because we're all feeling the same way in this moment. We're all experiencing very similar things. And what it really amounts to is that there is a much bigger we now that understands that what's happening to each of us is it's not our personal failure. It's not our individual struggle. There is a much bigger we that is saying with increasing volume and confidence that, you know, the economy by design has not worked for us, right? It's never worked for us. And we have an absolute mandate, as you just said, Fatima, about, you know, prioritizing racial and gender and economic justice, all of it. And we have a mandate together to fix the caregiving crisis that we're in. So I'm feeling more encouraged by all of us in this conversation. We're not alone. We're not alone to sink or swim on our own. It is actually all of us who are going to demand the investment that we need and we deserve to have the inclusive and sustainable care infrastructure. So I also feel really good that we know how to do this a little bit. We have been organizing together and winning really important pieces of the care infrastructure that we need. And, you know, it's organizing with and by all of us who provide care. We've all talked about the care we're providing in this crisis. Together we have won more than 60 new paid time to care laws at the state and local level that have really brought protections, new protections to more than 55 million workers and all of our loved ones. And I wanna invite Susie to join me in this conversation, because something that you shared with me when we were talking is, you know, the key to this infrastructure is a really well cared for care workforce. It became really obvious to me when we were talking that you are the hub of your community, clearly, Susie. And you said something that now sticks with me, right? You said, everybody's talking about us as essential workers. We have always been essential. And the other thing that I heard you say in the film was that you've never been as scared to do your job. And so what I want to ask you, Susie, is what kind of support do care workers need to feel supported in the critical work that you're doing right now? And you're on mute, so come off mute so we can hear you. There you go.
I'm so sorry. Thank you for having me, Wendy. First off, I think our equipment that we're buying it's gone out the roof with the pricing. We would go and buy a 50 piece, like the mask for that holds in a box, 50 in a box, and I would pay $2 and change for that, and now it's just like $25, $30 for that same thing. That's ridiculous. We're barely making it and working, and to have to pay that outrageous amount for our equipment we need just to do our job, that's not right.
I know. The one of the things that I know that you do for your community, and you were sharing a little bit, and it's also something that stuck with me since our first conversation, is you were talking about the training that you actually do. I don't even know what spare time you have. I mean, but the training that you do with the younger workforce that's coming up under you.
Let me tell you, even before this pandemic, I foresaw that we were having trouble getting the younger generation to do this kind of work, to go to this type of work, in this workforce. I'm worried about who's going to care for me when I get to the age that I need care. And it's not there, and it's not appealing to them because there's no benefits. We don't have the luxury of working from our home like some do. We got to get out there and do it. They don't, the pay is making people not even want to come to this kind of work. The benefits, there's no benefits. There's no paid sick leave, vacation days, holiday pay, even right now, something like hazard pay. And that's not going to get people to come even do this kind of work, because there's no initiative for them to want to do it. If it's not there. I mean, they're like, why would I do that? I'd rather go flip burgers at McDonald's.
Yeah, I know, and it's got to be frustrating, and yet everything about your spirit in the short amount of time that I've known you and gotten to know you is that you have this great sense of abundance, that you're doing life-sustaining work. You know it. You know these families. You work with them. They invite you into their homes. When you lose somebody, you told me you're there with them, right by their side, by their family's side. And so if you were to totally flip the script and just sit for a minute in what the work would feel like and look like, if you were well supported, what would that look like to you?
A lot of stress, a lot of pressure would be lifted off my shoulders. We are not giving any type of guidelines. One person would come on TV and say this, and one person would say something else. There's nothing in place that says A, B, C, or D. You got to do these steps. I've worked with all kinds of elderly folks that have different ailments. I took care of people that have tuberculosis, people on hospice care, people who have AIDS, all types of different cancers. And I always knew what I needed to do to protect myself and to protect the person I'm taking care of. Now we don't. We're not given any kind of guidelines. And that's where I find it that I'm venturing into unfamiliar territory. because we're not being informed. And I feel we should. If we're putting our life on the line, because we bring this home too, you know, we have to come home. I'm taking care of my spouse, my wife, who has a lot of underlying health issues. And just recently in November 3rd, I lost my father, and my father took care of my mother. And now I've added that to my list of things I do, you know. Now I'm caring for my mother, who is elderly. And I just feel if we were given what we need to do our job, I mean, to me, it's simple, but it's not rocket science, you know.
It shouldn't be. It shouldn't be.
And it's like that Congresswoman that came on, hey, let's just get it done. And that's what we need to do. Get it done. Get everybody. It takes all of us. If I didn't go take care of the lady I take care of, I'm with her 12 hours, Monday, Tuesday, and Wednesday, 6 a.m. to 6 p.m. If I was not there, the daughter could not go to work. The daughter couldn't function and be a part of society. She would have to stay home taking care of her mother. So it all comes around. What comes around goes around. We're there to help them with their loved one, so they can go out and do their part to the community. They could go out and work. If we weren't there, who would be the one doing it? The family would. And that puts a lot of stress when we come in. That puts a lot of stress off the family, because we're in there, you know, we're the eyes and ears of their mother and father when they're not there.
Yeah, you describe this ecosystem, and yet we're not supporting the work that is necessary. Not just, you know, for it's the work that makes all of their work possible, as Caring Across Generations always says. Well, and so, yeah, go ahead.
Well, what I'm trying to, you know, I saw all this before the pandemic. The pandemic just exacerbated it more. And people are looking there. It's always been there. Yeah. This unequal pay, the way we are treated in the workforce as far as benefits, that's always been there. That's why a lot of us caregivers work so many hours, because we're trying to get the pay that we want. There's two things, what your wants and what your needs, you know. We need to get good pay, because that's what we need to sustain ourselves, pay our bills. We know what we need. And a lot of us have extra jobs and work a lot of hours just to get what we need to provide food on our table, pay our bills. You know, before the pandemic, I was working 110 hours a week, and now I'm working 80. Now, just recently, a lady I was taking care of, one of the staff contracted COVID. So now the lady has tightened her bubble, and now she just has live-in. So now that gets me out of a job now, because she only has live-in. And the live-in are taking care of her 24/7. And she's even afraid, you know. She knows, and we assure her that we're being safe and we're doing all the precautions we need to, but they're still fearful, you know. They don't want to bring it into their house. And when that lady contracted the COVID, her family said, no, let's just have essential people come in, that just 3, and that's it, you know. Yeah. But it's really trying times we're living through. And I've done this kind of work since 1986, and I've never, ever been in the predicament in my mindset the way it is now. It's just, and I'm a very positive person, you know.
Yeah, you are.
Good parts and the good side of things, but it's really dire right now. It's really.
I know it is. And the way that you build community, Susie, and the ecosystem that you talk about and that you're helping to create, we need to do what we can, everything we can, to make sure that we are creating a well cared for care workforce. Susie, thank you for everything that you're doing every day. Take care of your family and take care of your community.
Thank you. Thank you for having me. And let's get it done.
Let's get it done. With that, I'm going to hand it to the amazing Josie Calipeni with Caring Across Generations. Josie, you may be on mute.
Can you hear me now? Great, thank you. I was just saying, I hope you are as fired up as I am. It is one thing to talk to experts and electeds, and then it is another thing to hear stories of impact and that bring to life what we are talking about. As Wendy said, my name is Josie Calipeni. I am the Director of Policy and Government Affairs for Caring Across Generations. I am fired up and ready to go win the family care agenda that we all need, and we have a real opportunity to do so. I'm excited today to introduce Representative-elect Jamaal Bowman from New York's 16th District. Born and raised in New York City, Jamaal Bowman is an educator, a husband, a father of 3, and a new incoming member of Congress who is a champion of working families. As I was reading Jamaal Bowman's bio, I saw in there that he is an educator, and I am constantly struck by the reality and the things that educators get to see on a regular basis, firsthand, the impacts of caregiving families, distracted young caregivers, missing attendance, and sometimes a lack of engagement of families because of caregiving demands across the generational spectrum, and all of the other things that they get to see firsthand because of the impacts of siloed and underfunded systems. And without getting too deep into his bio, there's a quote from his website that I read and it struck me, and I wrote it down and I have it displayed, and it says, while our leadership is focused on wars and privatization of government services, our kids and communities have been legislated out of the American dream. And the care agenda is exactly the opposite, is the thing that we are fighting for that centers families and centers care. Caring Across Generations has spent the last few years doing outreach and education in Congress to make sure that all members of Congress are hearing about the joys, challenges, and needs of caregiving families, from workers to sandwich generation caregivers like Lynn, for the need for paid family and medical leave, to the need for real, meaningful home and community-based services. So you can imagine how excited we get when we get to welcome new members who won as champions of working families. And it just centers my excitement that we are going to win this. We are going to get this done. So I'm going to kick us off with a question from your home state, Representative Bowman. Mayan Sailing Sun, a resident of your very own 16th District of New York and a proud leader of the New York Caring Majority, asks, family caregivers, seniors, people with disabilities, and home care workers are, as you know, on the front lines, not only of this pandemic, but also of the climate crisis. In what way can care infrastructure support a more sustainable and resilient future for all of us? And to really get down to it, we know that there's a difference between campaigning and governing. And you're past campaign mode, it's governing time, it's legislating time. And we also wanted to know, what steps can Congress actually take? What steps will you take to make a care agenda a reality? Thanks for being with us.
Well, it's a pleasure to be with you all. Thank you so much for having me. I believe strongly, and I feel with all my heart and soul and all of my DNA, that care has to be the center of the rebirth of our country and the rebirth of our society. As we implement new policies in response to COVID, in response to the racial reckoning that we're dealing with, and in response to the economic crises that we're dealing with, we have to rebuild our economy in a way that keeps the environment clean, and renewable, but also centers care. And for me, when I hear care, it's all about love, it's all about empathy, and it's all about compassion. It's about caring for our world, caring for our environment, and caring for each other. I'm glad that you started with my experience in education, because as an educator, as a teacher, as a school counselor, as a middle school principal, the first thing you have to do is create an environment of care so that the children that you serve and the teachers that you work with and the parents you collaborate with feel comfortable in the school, in the classroom, in the environment. And it's because of that comfort that you can provide an excellent education to kids. And I can't tell you how many kids have come to our school struggling in so many areas. Food insecurity, housing insecurity, but mental health challenges in middle school in places like the Bronx are paramount. I had so many kids over the course of my career who would do things like self-mutilate in our bathrooms, who presented with suicidal ideation and had nowhere else to turn. And we were one of those schools that were known as a restorative justice school and a safe school who didn't turn to punitive measures when our kids needed support. We had social workers in place. We had school counselors in place to provide the psychological, mental health, and social and emotional needs of our kids. So it's personal to me from a professional perspective, but it's also personal in terms of my family situation. My sister is a health aide. She's a healthcare worker right now as we speak, providing aid to my mom and to others. My mother is 76 years old, dealing with some kidney issues and some cognitive issues, and she requires care at least 8 hours a day. And what I learned as this all kind of came to a head during the campaign, and I was working with my sisters to try to provide as much care and support to my mother as she needed. And what I learned is the dense bureaucracy and the hoops that we needed to jump through to get mother care was completely unacceptable. And it's something that it shouldn't be easier for me to dial 911 to get a cop to respond to my apartment than it is for me to get care for my mom or other seniors across the country. And going back to my sister's been a health aide for about 10 to 15 years. She still makes minimum wage because our health aides do not earn a living wage. In many cases, they do not earn health insurance. And this is a gender rights issue, and this is a racial issue because most of care providers, as we know, are women, and most of them are women of color. So there's not much difference, just so you know, between campaign Jamaal Bowman and Congress-elect Jamaal Bowman, because we're still going to be fighting to grow the care economy and really help people to understand that without individuals providing care, the economy doesn't thrive in other ways. So for me, when I talk about care, I talk about safe staffing to make sure we have enough nurses in our healthcare facilities to care for sick patients, especially during as we deal with COVID. I talk about universal childcare to make sure we're providing nurturing environments to our children, especially focus on Head Start, the first 1,000 days of a child's life. But from birth to age 8 is critical to ensure we provide universal childcare and early childhood education. We talk about hiring more teachers to lower class size and to provide individualized supports to our kids who need it, especially because we're going to see an achievement gap that's growing during this pandemic because kids have lost so much school time. So they're going to need more teachers. They're going to need tutoring. They're going to need one-on-one supports. I support long-term care to make sure our seniors are taken care of, not just in and of itself, but as part of Medicare for all. We are the wealthiest nation on earth. We brag and boast about it. We should be able to provide universal health care, single payer system, free at the point of delivery, no copay to every single person in our country. I'm going to be supporting the fight to make sure our health aides have the right to form a union and are unionized so they can collectively bargain. Same thing with our early childhood providers who are not unionized in most places across the country. They need the right to form a union as well. So those fights are going to continue with me in Congress. Now, as you mentioned, Congress is a different beast. Many Republicans don't want to hear about that. Many Democrats also don't want to hear about that. They always focus on Wall Street and the Wall Street economy as opposed to the care economy. And for me, it's about showing that there are economic benefits to this, but there are also humane and moral benefits to this as well. And that's what we need to focus on going forward. So not only introducing and supporting brilliant policy that's already in place, but it's also about raising my voice and talking about these issues very publicly and continuing to work with you all and others to organize both on the outside and on the inside to get these things moving. Let's win Georgia so we could disempower Mitch McConnell, and then we could get something done right away. If we don't win Georgia, there are things that the president can do in terms of executive order. But in 2 years, we still have work to do, because 2 years from now, if we don't win the Senate this time around, we can win it next time around. So the work continues. There's no difference between what I spoke about and fought for as a candidate and what I'm going to be fighting for in Congress.
Representative-elect Bowman, thank you so much. And you know we're the community that's going to hold you to account. So we are with you in fighting to win for caregiving families. I'm so grateful that you would trust us with your caregiving stories. We definitely need more members of Congress asking themselves about the caregiving experiences they've seen and what that means about the future that we actually need to build. Thank you, thank you, thank you. I'm super excited about 2021 and what we win. I'll give you one last word and then I'll turn it over to Ijan.
One thing I didn't mention, family leave is something I'm very passionate about. And we talk about it in terms of weeks. I think we need to talk about it in terms of years. When I talk about the first 1,000 days of a child's life being so critical, we need to look at family leave more from that perspective than from the perspective of weeks. Just wanted to say that.
Thank you so much.
Thank you. Have a good night.
So exciting. So exciting. Thank you so much, Josie, for leading that conversation. I'm so fired up after hearing from Congressman-elect Bowman. Congressman-elect, thank you so much for your time and for your leadership. We're so excited to have you as a champion on all of these issues. And I don't think I'm ever going to forget the idea that care should be at the center of the rebirth of our nation. I love that concept. And thank you to all the incredible leaders who joined us today for this town hall. Congresswoman-elect Nikema Williams, Nicole Jorwick of the ARC, Dr. Michelle Hernandez, Fatima Goss-Graves of the National Women's Law Center, Lynn Redmond-Williams, Wendy Chun-Hoon of Family Values at Work, and Susie Rivera with the National Domestic Workers Alliance. Thank you all so much for joining us. And I want to give a huge thanks to the entire team at Caring Across Generations who put so much work and energy into putting this event together. You are amazing. And thank you for all you do to support caregivers. I know that together, this whole conversation has just reinforced for me the power that we have together. We're going to ensure that care is a top priority for the new administration taking office in January. We're going to make sure the first 100 days of the new Congress are our days, our time. They're going to be critical for jumpstarting our economic recovery, and it is an unprecedented opportunity to bring us closer to this vision for care in America. It's an opportunity to ensure all of us are able to meet our needs and those of our loved ones. And with all of your help and your action, we can make care jobs good jobs. We can expand access to childcare and home care services, and we can secure paid family and medical leave for all of us, all of us. Care is a need that we all share, and one that just can't be parsed out depending on how old you are or where you live or the work you do. Families have been forced to navigate this need in isolation for far too long. And it's so painfully obvious it's not working. It's not working for anyone. And so if we seize this opportunity, we can actually recover into an economy that's more resilient, more equitable, a 21st century economy that really does value care, and it values work and family at its core. And as the Congressman-elect said, it's not just an economic issue, it's also about our humanity, and it's about our morality. It's about all of these things. And so thank you so much for all of you at home who joined us today and tuned in. And we want to just have one more ask of you, which is to join us in this ongoing fight to realize this vision, to sign the Care for All pledge by visiting caringacross.org/pledge. That's caringacross.org/pledge. On December 8th, we're going to be doing our first big action together. We're going to be calling members of Congress to make sure that they prioritize caregiving families and care workers in our economic recovery. And if you sign up at that pledge, caringacross.org/pledge, and join us, we'll send you a reminder and give you all the tools you need to take action with us on December 8th and beyond, because we're in this to win this, and we're going to keep on taking action until we do. Thank you again so much for joining us, and have a great night.
Thank you.